My name is Katie Dodd, Dr. Dodd. I am one of the cardiologists here. I specialize in heart failure. I knew from a young age that I wanted to take care of patients with heart problems, in particular heart failure, because my father had rheumatic fever when he was a child. And so all of my lifetime, a lot of my lifetime was spent with him in hospitals being cared for by cardiologists. So I felt very comfortable being in the hospital, and I knew that when I got older and developed my own career, I wanted to do something similar and take care of patients with a similar disease process that my dad had. And it's easier for me having an understanding of what patients and their families go through, having been on that side of things. It's exciting for us to just be developing a heart failure program here. I think step number one is identifying patients with heart failure. And speaking of regions in the country, there's really heart failure is rampant everywhere within the United States, but especially in the South. And so we're excited to start seeing patients both in the hospital, and then we also have heart failure clinics now where we'll be seeing patients in the outpatient setting and following them and having really good continuity with them. There's a lot of good new medical therapies for heart failure that we're looking to get patients identified with heart failure started on. We have new device therapies as well that we can treat patients with heart failure with that we are doing at this institution. And then, down the road, there's also a capability, we may have the capability and ability to develop even what we would call an advanced heart failure program, where we may be able to have a VAD program or artificial heart pump program here for our patients with heart failure, or even transplant. So that's kind of more to come, but we're really excited to start really taking care of patients with heart failure and seeing them regularly in the outpatient setting as well. And starting to see patients here with heart failure, I will say that there's a lot of pathology, and we're seeing patients with a variety of different etiologies and causes for heart failure. And one of the exciting things about heart failure and here in general is that different patients have different causes for heart failure, and I get to interact with a lot of different teams. So for example, if there's a primary rheumatologic problem for patients' heart failure, I get to work with the rheumatologists. If there's a primary hematologic problem, I have a patient right now I'm taking care of with AL amyloidosis. I get to work with a hematologist here. And so being at this institution, there's a lot of collegiality and a lot of good opportunities for collaboration, which is wonderful. Our surgeons are also integrally involved in our patients with heart failure in particular. We have a very good structural program here too. A lot of our heart failure patients have valvular disease, and we have new therapies that we can do that are slightly less invasive, and then we have a very good cardiac surgery program here as well. So it's a very good place to collaborate. In terms of research, my background actually is in geriatrics. I have an interest in palliative care as well, and also in infiltrative cardiomyopathies, things like sarcoidosis, amyloidosis. I'm hoping that we can even develop like an amyloid and sarcoid clinic here. Those are causes for heart failure that are not always recognized, and we have new therapies to treat those types of heart failure as well.